The John A. Burns School of Medicine is celebrating a big milestone. Its 60th anniversary. It's our privilege to welcome the Dean to our program this morning to celebrate this key part of our community, Dr. Sam Shoemaker. Nice to have you with us.
Thanks, Tanya. Thanks for having me on this auspicious occasion.
It is 60 years.
60 years.
Quite a milestone, not just for the School of Medicine, but also for the state.
The state, yeah. So the School of Medicine has trained, literally trained, half the doctors practicing in the state of Hawaii. So this is a testament to the vision of our former governor, John A. Burns, who realized that we wouldn't be able to import enough physicians from the continent to take care of our local population. So the solution that he proposed was to create a medical school here. 60 years ago, he did that. And 4,000 graduates later, we are still in the business of producing future physicians for the state of Hawaii.
Well, that's incredible. Let's talk about growth over 6 decades. A lot of advances, a lot of changes in medicine and healthcare during this time.
For sure, for sure. There are a lot of trends that we have to keep our students abreast of as they're preparing to go into practice themselves. We have, of course, artificial intelligence, which is going to transform the practice of medicine, and it's ironic because most of our students probably know more about artificial intelligence than we, the faculty, do. But nonetheless, they need to know how to use AI safely when they're taking care of patients, and so that's part of our curriculum at this point in time.
We continue to have news stories about the physician shortage, like you mentioned, graduating so many. So what else is being done on that note to make sure that we have enough providers to service our community?
Well, we're modestly increasing our medical school class size. We have 77 places in our class these days, and we have about 2,400 applicants every year, so it's very competitive. The other thing we're doing is we're expanding our residency training programs here in Hawaii. So we're starting a new neurology program this next year. We started a gastroenterology fellowship last year. So we're trying to create these residency training programs so more of our graduates can stay locally and do their training. And if they do that, then we have about an 85% retention rate. So it's quite outstanding.
It's incredible. We had a story earlier in our newscast about the OBGYN shortage, and that's certainly not the only type of specialists where we're seeing this sort of deficiency.
That's absolutely correct. And it's by far worse on the neighbor islands. So we're really making a concerted effort to get out into the neighbor island communities and help support the practicing doctors in those areas.
Well, I want to touch on the government shutdown to see if there's any impacts that are trickling down to JABSOM. What can you tell us about that?
Well, we're still analyzing the situation, but it looks like the primary effect on JABSOM might be delays in processing grant payments through the National Institutes of Health. So that could slow down our research mission quite considerably, and we're monitoring that closely. We are very, very grateful to our congressional delegation for all they're doing to support Hawaii during this very difficult time for our country.
Oh, very important to make sure that the advances continue. Thank you so much, Dr. Shoemaker, for joining us today.
My pleasure. Thanks for having me.